low end. By the time we get all the way up to the 400% mark, those individuals will be capped at around 9%. So they'll never pay more than 9% of their income towards the cost of a premium on an annual basis. And again, the tax credits they would qualify for would make up the gap between their contribution and the ultimate market price of those particular plans. Now, there's a whole bunch of little, devils in the detail around additional cost-sharing components and a couple of other things. But at its core, that is really the system in place to hopefully make the cost of a premium for an insurance plan for individuals in those categories more affordable than it may have otherwise been. The word affordability is an exceedingly loaded term. We don't profess to say that $100 is affordable for someone, but hopefully it's more affordable compared to what the overall price of that plan would actually be. So we're obviously very focused right now on October 1st of this year. That is when the exchange goes live. That's when we'll flip the switch. The system will be open. Our full marketing and promotional activities will be in place. Brokers, navigators, call center support will be up and running, and we will be highly engaged in helping individuals understand the options available to them and enrolling in coverage. But certainly, our work doesn't end on October 1st. It actually just gets started at that point. So in terms of our vision for the future, we really are very, very hopeful that we are going to be able to introduce a new paradigm in the realm of a user-friendly shopping and enrollment experience for health insurance. Obviously, we have a huge part to play in reducing the overall level of the uninsured here in our state. We take that very, very seriously. I think as you can see in other states, most notably Massachusetts, who have rolled similar systems out, it's unlikely that the rate will ever get to zero. There is always a certain portion of the population that cycles in and out of coverage, but we're going to try to make as concerted an effort as possible to get that number as close to that as we can. First year, hopefully maybe we can cut the number in half, and then in subsequent years we'll continue to work with different populations that might not have been as engaged as possible during the first year, and we'll continue to drive that rate down each and every year. We want to make sure we're providing health insurance options. Many times consumers have one option. They might be aware of any options that they have, and so we want to make sure that it's very clear to consumers that there's a place they can go, they can do a side-by-side, apples-to-apples comparison, and really make an educated choice that will benefit themselves and their families. We do want to promote innovation and competition. I think as you heard at the beginning of our slide presentation here, we do have a marketplace which has standard benefit designs as well as non-standard benefit designs. So there's competition in terms of commodity type products that hopefully will push costs down, but then also making sure that we give carriers the opportunity to come up with new and different ways to administer services, et cetera, that hopefully will spur some additional innovation as well. And then lastly, and probably more importantly, this conversation regarding health reform, health care reform, health insurance reform, any kind of reform that impacts the health of ourselves, our communities, this conversation, I think as we all can profess to, is really just getting started, and it's probably going to be ongoing for years into the future. The Affordable Care Act, the Health Insurance Exchange, this represents a nice step to get this conversation moving, but the work here is not done by any stretch of the imagination. So we look forward to being a conduit to additional conversations on this in the future. We'll play whatever part is most appropriate to help spur these continued changes and hopefully lead to long-term system improvement in the future. So with that said, I think that's all the formal slides that we had here, but I'd be more than happy to take questions on anything at all. Insurance exchange, personal anecdotes, anything you want.
So I just want to thank you for giving an